Hi, I'm Stephanie Moore with UnityPoint Health, and I am joined here with Dr. Rosa. She's one of our, let me get this right, infectious disease specialists here at UnityPoint Health. And we're going to talk all things coronavirus because we know there's some misinformation out there, and we want to make sure that we're the reliable source. So we're going to dive right into it. Let's just start with, what is the coronavirus?
Yeah. Hi. So the 2019 novel coronavirus is a new type of virus that belongs to a large family of viruses called coronaviruses. Many of these ones infect humans. Some others infect animals. But this particular new strain has not been seen in humans before.
And what is the latest with it and its spread? We know where it started, and we know some of the numbers.
Yeah, so in terms of where it started, it seemed to have originated in Wuhan, China. Early reports were linking cases to the seafood and animal market over there. To this point, there have been about 20,000 cases in China with nearly 500 deaths, and many cases all around the world as well. Here in the United States, there have been 11 cases, and 2 of those cases have been linked to direct person-to-person spread amongst close household contacts of other patients. And now, in terms of what we know this virus looks like, or how are people presenting, right? How does the illness look like? We know that the majority of the patients are presenting with fever, cough, shortness of breath, but they've also been described as having diarrhea, nausea, and vomiting, and runny nose, and even some instances of some confusion as well.
Something top of mind for a lot of people is, how is this transmitted between people?
Yeah, so it is transmitted through respiratory droplets, which are essentially just tiny particles that are put out there into the world when an infected person coughs or sneezes. This is how many viruses are transmitted, including influenza. And so once those droplets are put out there, then another person can just inhale them and then get infected.
So that could be from sneezing.
Yes.
We aren't sure if it's touching a surface yet, but we do know about those droplets.
Yeah. So right now we do know that it's transmitted through respiratory droplets. We do not know if it's transmitted by touching surfaces that have been touched by someone who is infected.
The next question, I'm sure top of mind for people, is there any way to treat this virus?
So right now there is no specific treatment for the coronavirus, for this novel strain. Now, if someone gets sick, the type of treatment that they would receive is more to alleviate symptoms, and if they get very sick, then they would receive other type of supportive therapies for their lungs and things like that, but there's no specific antiviral medication or even a vaccine that we can use.
Who is most at risk for this? And if someone's pretty healthy, doesn't have any past comorbidities or mobilities, could they get this?
Yeah, so we know that there is what we call a spectrum of illness, right? So many people have had what would be considered a mild illness, like I said, some fever, some body aches and things like that. But some people have gotten really sick. The information that has come out from large case reports from China continues to support that it's elderly patients and patients with underlying illnesses that are at the highest risk of developing severe illness or even death. So elderly patients and those ones who have, underlying heart disease, chronic lung disease, and things like that.
So let's talk here. Someone walks into one of our clinics, maybe presenting with some of these symptoms. What are we doing here?
So currently we are following guidance provided by the Iowa Department of Public Health and CDC, and screening patients for fever or respiratory symptoms such as cough, shortness of breath, and a history of travel to China in the past 14 days. And it's important to clarify that screening is for those two things, for respiratory fever or respiratory symptoms, and a history of travel.
And those protocols we're following, you would have to send testing off to the CDC.
Yeah, so what would happen, is that if a person is found to have fever or respiratory symptoms and a history of travel to China, then we would contact the Department of Public Health and arrange for testing. Now, we would test for common viruses circulating in the community, such as influenza, but we would also arrange special testing for the novel coronavirus. Now, the novel coronavirus that test can only be performed at the CDC, so that's why we would collect the sample and then send it to the CDC. Now, people might be wondering what's going to happen with one of these patients, right? Or what would happen if someone is thought to be potentially infected with the new virus, right? So ultimately, where a person is treated will depend on how sick they are. If someone comes with fever or respiratory symptoms and the history of travel to China, and we proceed with testing, but their illness is mild, then they would go home, and public health would advise voluntary home confinement. If a person is severely ill, so that they need to come into the hospital, then we would admit them to the hospital and follow all the infection prevention precautions during that hospitalization.
A lot of people travel for business around here. What's the recommendation right now if you do have travel plans?
Yeah, so the CDC has issued a level 3 warning, and that essentially recommends to avoid all non-essential travel to China.
And of course, we're here in the Midwest. It seems scary, but we're also in the Midwest. Should we be as worried?
Yeah, it is. It's the world is more and more global, right? I can tell you that I am very scared about circulating viruses such as influenza, and would say we continue to do screening for other potential threats like the novel coronavirus. There have been the number of cases here of the novel coronavirus here in the U.S. are very, very low. For other things far scarier at this point for us here in the Midwest, I would say.
Yeah, so let's talk about the flu a little bit, because another virus that we should be a little more worried about.
Yes, definitely. So influenza activity at this point is actually very high. There's been estimated 19 million cases of flu and 180,000 hospitalization and 10,000 deaths from it. The good thing is that we actually have a vaccine that we can use. So one big recommendation is that it's not too late to get your influenza vaccine.
And then we need to be all practicing during this sick season several things to just keep us safe from all viruses and those kind of things.
Yeah, so we continue to recommend, wash your hands. If you don't have soap and water available, then it's okay to use an alcohol-based hand sanitizer. It's important to avoid contact with people who are looking sick. And also, if you are sick yourself, then stay home and give yourself a day or two to actually get better. And then the other thing is to keep the surfaces at home very clean. And lastly, again, I cannot emphasize enough how important it is to actually get your flu vaccine.
And any age, we're just recommending that it's never too late. We can say that again.
We can say that it's not too late to get the influenza vaccine, yes.
And then, of course, we mentioned this at the beginning, but there's just a lot of information with social media and, different outlets out there. But we recommend CDC and UnityPoint Health for accurate information. Would you agree?
Yes, I would recommend that. And it is encouraging to see that CDC has been partnering with some of the big browser companies to make their results like top of your browsing, right? So yeah, go to reliable sources of information like UnityPoint, like the CDC. And if you are feeling sick, actually go ahead and contact your doctor so you can get care for.